Hi, we're here today to talk about nitrous oxide, the way it's applied to the patient, the indications it has for the office, the indications for the patient, and to familiarize ourselves with machinery such as the flow meters, the tubings, and etc., and their purpose in some brief terminology so you can talk to the doctors with a somewhat educated format. I'm sure we've all had nitrous oxide administered to us during routine dental procedures. Nitrous oxide is not an anesthetic, it is an analgesic, like aspirin. It is an analgesic, it's not an anesthetic. It does not put you completely out. What nitrous oxide does to the patient during the procedure is it makes the patient more compliant, more still in the chair, and easier to perform the procedure on. The patient still feels the pain. The patient may interpret the pain differently through its brain channels, but nonetheless the patient still feels pain. The doctor uses nitrous oxide in conjunction with an anesthetic, meaning Novocaine, any local anesthetic that he puts into your mouth by injection or by a needle. This works in conjunction with it. Usually the nitrous oxide is administered before the injection of Novocaine is given. It takes a measurable amount of pain away from the patient because the patient's anticipating the pain. It just drops the anticipative factor down to zero. Now let's talk about the dosing of nitrous oxide. Nitrous oxide is used in conjunction with oxygen. Nitrous oxide is poison in its purest form and can cause toxemia or hypothermia, meaning starvation of oxygen in the brain. Okay? So it is always administered in a dose with oxygen in it. At the end of the procedure, you are always flushed with oxygen to ensure that you have every bit of the nitrous oxide washed out of your body and oxygen has taken its place. To administer the nitrous oxide, we use an apparatus called a flow meter. You will hear this called various different components. You'll hear it called a nitrous head, you'll hear it called a flow meter, you'll even hear it called a nitrous machine. This essentially is the flow meter from my hand up. You can see your LPM guides, which means liters per minute. The blue for the nitrous, the green for the oxygen of how it's administered. Now, let's talk a little bit about the functions of the flow meter. A lot of flow meters are going to be key operated. Many are going to be key operated. This enables the operator to know that he's the only one operating the machine. Nitrous is to be kept in a secure outfit, securely locked up, to where only the administrator or the doctor or the assistant under his supervision can administer nitrous oxide. At all times when nitrous oxide is administered, there must be a resuscitator in the office. This is called an ambu bag or a manual resuscitator. You've all seen them on TV in the ambulances. Goes over the patient's face with a nose piece. The bag is squeezed to respirate the patient or to make the patient breathe. This apparatus must be used in conjunction with the nitrous head for the administration of nitrous oxide. Most nitrous oxide flow meters have a fitting on the back, a quick disconnect fitting like this one here, that you can actually plug a respirator or a nasal cannula into to provide oxygen to the patient. And it will only draw on the oxygen tank. It's called a demand valve, a resuscitator demand valve. Now let's talk about some of the components on the flow meter. This is your actual dose meter itself, or the flow meter. It consists of glass tubes that are not at all unlike a test tube. They're held at various calibrations, usually 1 liter calibrations. The nitrous is dosed in conjunction with the oxygen, again from an earlier statement. You never want the nitrous output, your ball to float on the nitrous and the flow meter, more than you do the oxygen. You always have to have more oxygen coming in than nitrous. If at any point during your repair you see that the nitrous ball overrides the oxygen ball, the flow meter is not right, stop it, pack it up, and send it to corporate. There is nothing serviceable inside these machines that you should be servicing in the field. These are precise tolerances and calibrations that must be observed by the factory or by SER, small equipment repair. We went over our liter readings, our flow meter. We'll look at the fascia of the machine. We have an on and off knob, which is constituted by the key, on and off. We have volume control knobs for nitrous oxide and oxygen respectively, where you set your flow rate to sedate the patient. Off of this we have a bag tee. For obvious reasons, this is called a breathing bag. Breathing bags are available in 1 liter or 2 liter sizes. All the breathing bag does is, as the bag expands and contracts during the procedure, you have an easy guide to look over to make sure that the patient is still respirating or breathing. The bag contracts and expands with the patient's breath. It's called a breathing bag. It's a very important part. In conjunction with the bag, on the delivery end of the nitrous oxide machine, when we say delivery end, we're talking about the end that actually delivers the mixed gas to the patients. By mixed gas, we're meaning nitrous oxide. Our first component is the corrugated breathing tube. Easy to see. It's corrugated. It's somewhat flexible. This allows you to dose the patient without having the machine right up to their head. This gives you a little leeway where you can turn the machine and read the machine. The doctor can turn the machine and read the machine and make sure the dosimetry is right before the patient respirates the machine, before they breathe the gas, the mixed gas. Your corrugated breathing tube carries to the rubber goods, and it's easy to see why they're called rubber goods, because they're made of rubber. On the end of the rubber goods, you have a nose piece. You have a nose piece. This nose piece is interchangeable with the rubber goods. Now, they make disposable nose pieces, or the doctor can elect to use the same nose piece for every patient. They make them in different sizes. They make them adult large, adult small, adult medium, and they make them pedo for children. You want the nose piece on the patient like this, so that the oral cavity isn't covered, so the doctor can still do his procedure. The doctor then tells the patient, after he's placed this on his nose, on the patient's nose, to breathe through your nose and exhale and inhale through your nose only. That way, they're getting full benefit of the analgesic. They're getting full benefit of the mixed gas. Now, several doctors have masks that are flavored. This is great for orthodontists and pediatricians, pediatric dentists. The flavor, they'll smell like cinnamon, they'll smell like vanilla. It's a great way to make the patient accept using the gas. It will also ensure that the patient brings their mask back to use during their procedure. You put it in a Glad bag and give it to the patient, and they'll bring it back for the next procedure. It cuts down on your expenses. It cuts down having to clean this, because if you don't clean this mask, the nose piece and nasal hood between patients, and you have a patient that wears a lot of makeup or has a lot of facial oil, it's going to show on this rubber part, and it's not very hygienic. There are several cleaning products to clean the nose piece between uses, or it's better yet just to change the nose piece out. Coming off the nose piece, the patient wears the nose piece like this. The doctor comes around the headrest, around the back of the patient's chair, around the back of the chair, and the headrest on the chair, with the patient laying supine so he can still get to the oral cavity. This fits around the headrest of the chair, guys, and comes from the back of the chair, delivering onto the patient. At the end of our rubber good tubing, our nose piece tubing, as you'll notice, we have some corrugated tubing, and we have a gauge on this corrugated tubing. Another reason why you tell the patient to only inhale and exhale through the mouth, through the nose and not the mouth, is because as the gas is exhaled, it produces a poisonous gas. It produces carbon monoxide. You don't want that carbon monoxide hanging on atmospherically in the operatory. It's hazardous to you. It's like being in a garage with the motor running to a lesser extent on your car. They scavenge the gas. The breathed out gas, the exhaled gas, is scavenged. They use a scavenger meter. They set it to a very low point. The scavenger meter, in turn, hooks in to the big suction coming off of the unit, off of the assistance arm on the unit, like so. The suction's then turned on. As the patient breathes out, it scavenges the gas, pulls the gas through the sewer, and dumps it out into the sewer, rather than having it empty atmospherically and ambiently into the operatory. One of my biggest problems with nitrous, and I'm sure some of you guys out in the field have noticed this, my nitrous just it's not sedating my patient. Go in there and check the scavenger rate first. If the scavenger is turned up too high, it's actually sucking the gas out of the nose piece before the patient has a chance to breathe the gas and get the beneficial knockout of the gas. So scavenge very slowly. Set your scavenger rates very low. You want the patient to get the full benefit of the gas and not the vacuum pump, okay? Again, all this can be cleaned. There's scavenger cleaner, there's nose piece cleaner, there's a product called PICO, P-I-C-O, nose piece cleaner that can be used for this, okay? Now, let's move on to the lower part of the cart here. This is a mobile system. Today we're discussing mobile systems. There are two types of systems. You can have an office pre-plumbed for nitrous, and they use a tank room and the large welding style tanks with a nitrous manifold, and it delivers them to quick disconnects at the office. That's the central system. The central system requires very, very, very expensive plumbing and very, very, very thorough forethought before you put it in. If you're going to plumb a central system, you have to use a plumber that's qualified to do medical gas, because this is a medical gas. In the plumbing on this, you can't use compression fittings, you can't use flare fittings, you can't use soft copper. You have to use KRL, clean style copper, and it has to be silver soldered and with no flux. Okay? That's why we drop down to the mobile systems that we're going to be concentrating on today. These smaller tanks are kind of like scuba tanks, a little smaller. They're called E-tanks, E for Edward, E-tanks. Okay? As you get your tanks, they go on a tank yoke for obvious reasons. The tank yoke acts as a suspensory for the tanks and holds the tanks that the gas is being drawn out of, the gas and the oxygen. It also makes the system highly mobile by holding the tanks up off the ground. On the tank yoke, on the tank suspensory or the yoke, we have regulators. The regulators and gauges, these regulators are preset, gentlemen. Do not mess with the regulators. If you feel that the regulator is out of kilter or is out of adjustment, replace the regulator. Most of these parts for this nitrous stuff we can get through Belmed. And we are a Belmed dealer. If you have problems with nitrous, call Belmed. You can either call me as usual or call Belmed. I prefer you call the factory first. They can fill you in and give you exact tolerances, exact specific gravities on the gas, MSDS information on the gas, the whole 9 yards. Now, moving back down to our suspensory, we see our regulators and we see our gauges. Emanating from the gauges to the nitrous head is a blue and green cloth-covered hose. Green is oxygen. Colors are important in this. Green is oxygen, blue is nitrous oxide. Okay? These high pressure hoses are a service item. Good parts sale for you. They're in the DCI catalog. The rubber goods, the breathing bags, the scavenger circuits are all field serviceable items. DCI or Belmed. Ordered through parts at dentalfix.com. Be happy to get the parts for you. And these parts do dry rot and they do require replacement. You'll go in offices and see pieces of duct tape on the breathing bags. It doesn't make it work any worse. It doesn't make it work any better. It makes it look like hay. You know, and I'm sure the doctor wants to keep a nice, clean, sterile looking environment in his office. Okay? Now, from our tank yoke, we have our tanks. The tank can run, the system can run on 2 tanks. One must be nitrous, one must be oxygen. Because the flow meter has a default in it. If it doesn't sense the nitrous pressure coming from the nitrous fittings, and if it doesn't sense oxygen first, you'll have no nitrous function. It has to have oxygen in it first before you'll have the nitrous function. And it's a good thing because the doctor could hurt a patient. So you've got to have oxygen in conjunction with the nitrous to even make the machine come on. Okay? So we have our tanks. Our tanks are suspended like so in the yoke. I always put my foot under one to support it. Pull it out and drop the tank. It's as simple as that. It's as simple as that. The doctor should have 4 tanks on the machine. As I was saying, it will run with 2. You always want to run 2 oxygen tanks to 1 nitrogen tank because at the end of the procedure, your lungs are flushed out with oxygen to wash all the nitrous out of your lungs. They flush you out. And to flush out uses probably 3 LPM. That's a lot of gas. That's a lot of oxygen to flush. So that's where you're going to use a ratio of usually 2 oxygens to 1 nitrous. And that's on a mobile stand or a tank stand, anywhere. 2 oxygens to 1 nitrous. Now, a lot of your problems, you're going to say, my gas is leaking. The doctor's going to say, my gas is leaking. My gas is leaking, my gas is leaking. I'm using a lot of gas. Well, look, there are washers that go in this yoke. I'm going to pull one out here and show you. If I pull it out without tearing it up, more power to us all. There we go. Sometimes the washer is going to be a plastic disc like this. Sometimes it's going to be a metal disc with a fiber interior in it or a rubber interior. They all do the same thing. Remind your doctors when they have the bottled gas people, the people that deliver the gas, also have them leave washers. These washers need to be changed out every time the tanks are changed. Okay? Every time. And we can get washers for these if they keep losing washers. It's always best to put them in a coin envelope and take them up under the machine. That way you always know where the washers are. Get these washers from Belmed. The right metal ones, okay? Usually the bottled gas people will give them out with tanks when they change the tanks out. Usually the bottled glass people actually come in and change the tanks out for them, okay? Now, let's in review. Flow meter, rubber goods, scavenging circuit that hooks into your HVE to scavenge your exhaled gas. Corrugated breather tube, which is technically part of the rubber goods. Breathing bag, which is technically part of the rubber goods. But you can order these items separately from a rubber good kit. A rubber good kit is going to be somewhere around $399 to $600 for the entire rubber good kit with the scavengers on it, okay? Now, one of the downfalls of a mobile system is there's no alarm on them to tell the doctor when he's running low on gas. So when he runs low on gas, It just shows by running out of gas. The meters, the balls drop, the gas stops. On a central system, you have an alarm that tells the operator when he's running out of gas. It also cuts the tanks off manually at night. A good rule of thumb is to actually, at the end of use, if they keep having problems with the nitrous or the oxygen leaking, you will get a wrench with each mobile tube, with each mobile cart, and you'll get a wrench with the stationary systems too. Cut your tanks off at night. Let's put this on, lefty-loosey, righty-tighty, and cut the tanks off at night. That way you're not pressurizing the soft tubings all night, and there's less of a chance for leakage. Scavenging is very important. Like I said, 9/10 of your calls on this is going to be too much scavenging. Okay? Thank you very much. If you have any problems or any questions about nitrous oxide, please do not hesitate to call. This is very important. This is where the rubber meets the road. It affects patient health care. It affects us all. So please be generous with your questions. I'll answer them as well as I can. Don't hesitate to call Bellmed either. They are very helpful, and we're a dealer for them. Thank you very much.